everyone. Today we are discussing the cerebrum. Cerebrum is the largest part of the brain. It is highly convoluted. It has elevations and the depressions. The elevations are known as the gyri and the depressions are known as the sulci. It is highly convoluted because it has to get accommodated in the brain box. Only 1/2 of total surface area is visible and 2/3 is hidden within the sulci of the cerebrum. Human brain is gyrocephalic as it has elevations and the depressions, while as the reptiles and the birds contain the mesencephalic, that is the smooth brain. It weighs about the 1400 to 1500 grams in males and 1200 to 1300 grams in females. The effective weight reduces to just 50 grams because of floating of brain within the CSF. Now some fascinating pointers for the functionality of the brain. It forms 2% of the total body weight. The blood needed by the brain is 1/6 of the total cardiac output, that is 750 ml per minute, 45 liters per hour, and 1080 liters per day. According to the MONROE or KELLIE doctrine, there are 3 tissues within the brain box, that is brain, blood, and CSF. There is hardly any dead space within the brain box for any of these to expand. That means any among these, and brain is the compressible. If there is increase in CSF or hemorrhage, the brain will suddenly compress.
Two cerebral hemispheres. These are incompletely separated by the median fissure. This is the median fissure. It incompletely separates the two cerebral hemispheres. Anteriorly and posteriorly, this median fissure is complete. This is the posterior side and this is the anterior side. Anteriorly it is complete and posteriorly it is complete. In the center it traverses up to the corpus callosum. This is the corpus callosum. The contents of the median fissure are FALX, cerebral pyometer and arachnoid meter, and anterior cerebral artery and anterior cerebral vein. It also contains the superior sagittal sinus and the inferior sagittal sinus. Now let's talk about its borders, surfaces and its poles. Now it has 3 poles: anterior pole, posterior pole and the temporal pole. Anterior pole, it is somewhat rounded. You see, this is the rounded. Posterior pole is pointed. Anterior pole lies medial to the superciliary arch and posterior pole lies supero-lateral to the external occipital protuberance. This is the posterior pole. Now this is the temporal pole. Temporal pole lies in the middle cranial fossa and is overhung by the lesser wing of the sphenoid. This was regarding about the poles. Now the borders. It has the superior-medial border, superior-medial border. It extends from the anterior pole to the occipital pole. This is the superior-medial border, and it has the inferior-lateral aspect. This is the inferior-lateral aspect. It has anterior part and the posterior part. Anteriorly it has the superciliary border. This is the superciliary border and this is the inferior-lateral border. Now the inferior-medial aspect. Inferior-medial aspect is divided into 3 parts. This one, anterior part. This is the medial orbital border. This is the medial hippocampal border. This is the medial occipital border. Medial hippocampal border lies around the cerebral pedunculus. Now the surfaces. It has the superior-lateral surface, it has the medial surface, it has the inferior surface. Superior-lateral surface. Superior-lateral surface is most extensive. This is most extensive surface. It lies between the superior-medial border and the inferior-lateral border. The medial surface. Medial surface, it is vertical, it is flat, it contains the cavity of the lateral ventricle. It lies between the inferior-medial border and the superior-lateral border. Inferior surface lies between the inferior-medial border and the inferior-lateral border. This is the inferior surface. This inferior surface is divided into 2 parts by the by the system of the lateral sulcus. This is the system of the lateral sulcus into the anterior part and the posterior part. Anterior part is known as the orbital part, posterior part is known as the tentoral part. Now about the sulci. First of all, this lateral sulcus. This lateral sulcus is most conspicuous among all the sulci. This is the lateral sulcus. It starts from the anterior perforated substance in front of the uncus. This is the anterior perforated substance in front of the uncus, and this passes towards the supero-lateral surface. On the supero-lateral surface, it divides into the three rami: the anterior horizontal rami, anterior ascending rami, and posterior ramus. These two rami are 2.5 centimeters in length, and this ramus is the longest ramus and is 7.5 centimeters in the length, and it turns into the inferior parietal lobule. This is about the lateral sulcus, and it contains the medial cerebral artery. Now the central sulcus. Central sulcus is the only sulcus which traverses the superior-medial border. This is the central sulcus. It begins from the superior-medial border above to the lateral sulcus. Anterior to the central sulcus is the precentral sulcus. This is the precentral sulcus, and area between these two is known as the precentral gyrus. As posterior to the central sulcus is the postcentral sulcus, and area between the postcentral gyrus. This is the postcentral gyrus. Anterior to the central sulcus is known as the frontal lobe. This frontal lobe has been divided into the three parts by two horizontal sulci. These are the two horizontal sulci. This is superior frontal sulcus. This is the inferior frontal sulcus. It divides into the superior frontal gyrus, middle frontal gyrus, and the inferior frontal gyrus. Inferior frontal gyrus has been divided into three parts by the anterior horizontal rami of the lateral sulcus and ascending rami of the lateral sulcus. The area between these two is the pars triangularis, and area in front of the anterior horizontal sulcus is known as the pars orbitalis. Area behind the anterior ascending sulcus is known as the pars opercularis. Now, the medial surface, this is the calcarine sulcus. This is the calcarine sulcus. It begins below the splenium. This is the splenium of the corpus callosum and extends up to the occipital pole. From this calcarine sulcus, from its maximum convexity, here is its maximum convexity, there begins another sulcus which is known as the parieto-occipital sulcus. This is parieto-occipital sulcus which also traverses the superior-medial border. Parieto-occipital sulcus. Now, area between calcarine sulcus and the parieto-occipital sulcus, this is known as the cuneus, and area in front of the parieto-occipital sulcus, this is known as the precuneus. This is the medial surface of the cerebrum. Here we can see the bundle of the white fibers known as the corpus callosum. These are the commissural fibers. This is the septum pellucidum. The sulcus above this corpus callosum, this sulcus, it is known as the callosal sulcus, and 1 centimeter above the callosal sulcus, this is known as the cingulate sulcus. The gyrus between these two is known as the cingulate gyrus. This is the cingulate gyrus. This cingulate sulcus turns upwards in front of the central sulcus. Area between these two is the central lobule. This is the central lobule on either side of the part of the central sulcus. This is the central lobule, and this gyrus above the cingulate sulcus is known as the median frontal gyrus. This is the median frontal gyrus. Now, the temporal lobe. Temporal lobe, this is the temporal lobe. Temporal lobe has also two sulci, superior temporal sulcus, and this is the inferior temporal sulcus. Because you can see here, superior temporal sulcus, inferior temporal sulcus. Area above the superior temporal sulcus is known as the superior temporal gyrus. This is the middle temporal gyrus. This is the inferior temporal gyrus, and this is the temporal pole. Now, the inferior surface. This is the inferior surface which lies between the inferior medial and the inferior lateral border. Inferior surface has been divided into two parts. The anterior part, the orbital part, and the posterior part is the tentoral part by the system of the lateral sulcus. This is the system of the lateral sulcus. Now, the interior part. This sulcus on the interior part, this is known as the olfactory sulcus, and medial to this is the gyrus recti. This is the gyrus recti, and in this olfactory sulcus there lies the olfactory bulb and olfactory tract. This is the olfactory bulb and this is the olfactory tract. Now, this orbital surface, it has been divided into the four parts by the irregular S-shaped orbital sulcus. This is the irregular S-shaped orbital sulcus. This sulcus, it divides it into the medial part, interior part, lateral part, and the posterior part. This was about the orbital surface. Now the tentorial surface. This is the tentorial surface. Is this medial elevation? This is the parahippocampal gyrus. This one medial to the collateral sulcus. This is the collateral sulcus. This is the parahippocampal gyrus, and this is the rhinal sulcus. Collateral sulcus extends up to the rhinal sulcus. Now lateral to the collateral sulcus is the occipito-temporal sulcus. This is the occipito-temporal sulcus. This one, occipito-temporal area medial to the occipito-temporal sulcus. This is known as medial occipital-temporal gyrus, and area lateral to it is known as the lateral occipito-temporal gyrus. This is the uncus. This one is the uncus. This was about the inferior surface.